Hello, this is Dr. Kent Sasse. Thank you for your interest and your courage in moving forward with learning more information about weight loss surgery. And I just wanted to offer a little bit of information that you may not be hearing everywhere, and sometimes the medical community is not always offering the best advice with respect to losing weight and keeping it off over the long term. And over these 20 years or so since I've been working in the field of weight loss and weight loss surgery, I've really run across what I call the three big myths. And so I'd like to tell you what they are and also explain why they're myths. So the first of the three big myths is that not losing this weight is somehow your fault. And I think this is probably the worst myth, because even though your friends and family may not say this, or even your providers or the doctors may not come right out and say that they think it's your fault, they imply it, because the providers may say, hey, you need to lose some weight, and if you would just diet and exercise a little bit more, that you could lose the weight. But in fact, that's not true. In fact, all the science shows that it's not your fault. What we're dealing with is a powerful programming of genetics and what's called the physiologic set point. And as was studied by the National Institutes of Health, looking at the Biggest Loser contestants, that programming is formidable. It's working day and night to lower your metabolic rate and push up the hormones that cause hunger and weight gain and fat storage. And so no matter how hard we work at it, that programming is never going to change until we do something specific that changes it, and that today is with weight loss surgery. 45 minutes and 4 Band-Aids changes that programming forever and turns a big headwind into a big tailwind that helps people lose weight and keep it off. The second big myth is that there is some special diet and exercise program out there that succeeds in losing weight or causing people to lose weight, when in fact the biggest studies and the biggest international and U.S. studies of medically supervised weight loss with diet and exercise and counseling and medications and therapy show just the opposite. People don't lose weight and keep it off. They may lose some weight temporarily, but it always comes back on because of myth number one, and it is not durable, and it's generally of low magnitude. There are rare exceptions to this, but 99.9% of us can lose weight temporarily, and the programming pushes us back, and all of the big studies show that and support that. Lastly, myth number 3, weight loss surgery itself is a risk. That's probably very pervasive out there, when in fact the medical evidence is overwhelming that having weight loss surgery today is a large risk reduction. It's a big risk reduction because it is safer and simpler than it's ever been. So a 45-minute laparoscopy with 4 Band-Aids translates into a pretty quick recovery time and very immediate effects of losing weight and improving health. So that in study after study, that very first year after weight loss surgery is a much healthier, lower risk year with less chance of health problems, medical problems, bone and joint problems, heart problems, lung problems, you name it. It's a big risk reduction. And I'll just throw in one more, a bonus myth, which is that the weight loss surgery is only short term. Sometimes people think, oh, I know someone who regained their weight. Yes, you can regain your weight, but if you really look at the big studies and the long-term data about the sleeve, the best procedure nowadays, most people keep off a lot of the weight, even 10 full years later and 11 full years later, as is shown in these slides. People keep off over 55 or over 60% of excess body weight, even 10 plus years later, which is amazing, and people will tell you that their life has been changed for the better. So if you haven't watched the webinar in which we explore this in a little bit more detail, take 45 minutes with your loved one or partner, watch the webinar. If you haven't come to the seminar, come to the seminar. And if you haven't scheduled your consultation, then please schedule your consultation so that you can move forward on making this change. There's definitely a solution there for you, and our team and I are here to help you find it.